Hi guys, this is Nehal Lagdiwala and today we'll be talking about Propionibacterium. What is Propionibacterium? Propionibacteria belong to the class of hierarchiaceae actinobacteria. All the bacteria of this species produce propionic acid as their end product of the metabolism and hence the name Propionibacterium. Now, let us take a look into the structure and physiology of Propionibacterium. Propionibacteria are small, gram-positive rods. They are often arranged in short chains or clumps. They are not acid-fast and hence they grow slowly in culture and they tend to produce chronic, slowly developing infections. They are commonly found on skin, conjunctiva, external ear, and the oropharynx of female genital tract. These organisms are anaerobic or aerotolerant. They are non-motile, catalyst positive, and capable of fermenting carbohydrate, producing propionic acid as a major end product. The two most commonly found species of Propionibacterium are Propionibacterium acnes and Propionibacterium propionicum. They are able to synthesize propionic acid by using unusual transcarboxylase. Its members are primarily facultative parasites and commensals of humans and other animals living in and around the areas of the skin. They are as such non-pathogenic, but propionibacteria have been implicated in acne and other skin conditions. They are also used commercially in cheese factories or cheese industries to create carbon dioxide bubbles, which become the eyes or the round holes in cheese. Pathogenesis, immunity, and epidemiology of Propionibacterium. P. acnes or Propionibacterium acnes is responsible for two major types of infections: acne vulgaris and second is opportunistic infection. Acne vulgaris is most commonly found in teenagers and young adults, and hence the name acne vulgaris. Opportunistic infections are found in patients with prosthetic devices like artificial heart valves or joints, and intravascular lines such as catheters and cerebrospinal fluid shunts. The central role is to stimulate an inflammatory response. Production of low molecular weight peptides by bacteria residing in sebaceous facilitates and attracts leukocytes. The bacteria are killed after release of hydrolytic enzymes like lipases, proteases, and high hyaluronidase. This helps in stimulating a local inflammatory response. Bacterial biofilm formation is central in the pathogenesis of infection related to foreign material, and P. acnes has been shown to form biofilm both in vitro and in vivo. In an experiment conducted with 93 subjects, biofilm formation by P. acnes isolates, either from invasive infections or from skin of healthy people, was analyzed. The majority of isolates from leaf infections produced biofilm in microtyre model, whereas the skin isolates were poor biofilm producers. This indicates a role of biofilm formation in P. acnes virulence. The type of distribution as determined by sequencing of RECA was similar among the isolates isolated from skin and from deep infections, demonstrating that P. acnes isolates with different genetic background have pathogenic potential. The biofilm formed on plastic and on bone cement was analyzed by scanning with electron microscopy and transmission electron microscopy. The biofilm was seen as 10 micrometer thick. It covered the bacteria and was composed of filamentous as well as monomorphous structures. It was found that the presence of human plasma in the solution and at the plastic surface inhibits biofilm formation which could explain why P. acnes primarily infects poor environments of plasma, for example, joint prosthesis and CSF shunts. This work underlines the importance of biofilm formation in P. acnes pathogenesis and shows that biofilm formation should be considered in diagnosis and treatment of P. acnes infections. Now, as talked earlier, Propionibacterium propionicum is associated with endodontic abscesses and lacrimal canaliculitis. This is nothing else than inflammation of the tear duct. Now let's take a look into the clinical disease and syndromes. Species of Propionibacteria can be found all over the body. Propionibacteria are generally non-pathogenic. However, when certain species of Propionibacteria contaminate blood and other body fluid, they can cause a number of infections, including the common skin disease, acne vulgaris. Acne vulgaris mostly affects neonates prior to sexual maturity or puberty. They are often seen as papules, pustules, and later non-tulocystic lesions that are typical of inflammatory acne. This is an example how P. acne affects the neonates or young adults. Now they also affect patients with prosthetic devices or intravascular lines. Now let's talk about the culture formation or the culture growth of Propionibacterium. Propionibacterium can grow on most common media, although it might take about 2 to 5 days for the growth to appear. Care must be taken to avoid contamination of the specimen with organisms normally found on skin. The significance of the recover of an isolate must also be interpreted in light of clinical presentation. Now let's talk about the laboratory diagnosis of the diseases or infection caused by Propionibacterium. As discussed earlier, P. acnes can be diagnosed by the formation of formation or the presence of biofilm. In addition to that, other clinical diagnoses include laboratory data, including white blood cells count, erythrocyte sedimentation rate, and C-reactive protein, fever, number of days for laboratory growth of P. acnes, organism sensitivities, antibiotic regimen, and length of treatment, surgical management. Infections can be diagnosed by 2 positive cultures. Now finally, let's talk about the treatment, prevention, and control of infections due to Propionibacterium. Skin cleansing as such is found to be not effective to treat Propionibacterium because the lesions they develop within the sebaceous follicles. For this reason, acne is managed primarily through the topical application of benzoyl peroxide and other antibiotics. Antibiotics such as erythromycin and clindamycin have proved to be effective for the treatment. In patients with prosthetic devices, the use of intravenous antibiotics is also made. So, to sum up our today's topic, today we learned about the physiology and structure of Propionibacterium, its epidemiology, immunity, and pathogenesis. the clinical diagnosis or syndromes of Propionibacterium, its treatment, prevention, and or control. These are my references if you want to research further or any further on the topic. So this is Nehal Lagdiwala. Thank you very much.